Hello everyone. This is a short recording of my lecture. Uh, the lecture is related to clinical anatomy of male reproductive system. Uh, Here is the learning outcomes. You have to know about anatomy uh, of scrotum, testis, epididymis, and spermatic cord, and related diseases. You have to know about anatomy of the penis and the mechanism of erection and ejaculation, including the controlling nerves and blood vessels. You have to know about anatomy of prostate, including its loops, blood supply, nerve supply, and related disease such as benign hyperplasia of prostate. You have to know about anatomy of vas deferens and seminal vesicle. So here just a slide showing the structures of male reproductive system or organs which can be found within the pelvis or outside, or internal and external. Internal, for example, like prostate here, external, such as the penis here, and also testis, for example. So just this MRI, which shows the previous slide, and showing the here, for example, prostate here, and the bladder, and behind the prostate you can find here the rectum. Here is pubic bone here in front, here pubic bone, and here is sacrum posterior. So we start by anatomy of the scrotum. So what is a scrotum? Scrotum is just muscle cutaneous sac which surround every testis and is formed of layers. These layers are shown here in this diagram and also dissected. So as you see in this diagram, the layers of scrotum from external to internal, first skin, under skin no fat, because fat is not good for spermatogenesis. It kills the sperm by apoptosis and induce infertility. So under skin there is a muscle layer called dartos muscle and fascia. Dartos muscle and fascia. And then deep to dartos muscle and fascia there is layers of 3 layers of fascia, external spermatic fascia, cremasteric muscle and fascia, and the last one is internal spermatic fascia. You can see these layers here dissected, okay? Also, so here is a testis here. So these layers also forming the wall of the scrotum and also, of course, surround the testis. The testis also is covered by a layer here, we call it tunica albuginea, which is adherent to the testis, and one here is called tunica vaginalis. You have to know that the scrotum has nerve supply, whereas the anterior half of the scrotum is supplied by branches of ilioinguinal nerve, and also while the posterior half is supplied by scrotal branches of posterior femoral cutaneous nerves and perineal nerve, which is branched from pudendal. Blood supply of the scrotum is from pudendal arteries, either external pudendal and also branches from internal pudendal. The scrotum drains its lymph to superficial inguinal lymph node. and this is clinically important. So the skin also over the penis is draining to the same lymph node, while the skin over the glans penis drains to deep inguinal lymph nodes. Remember that here cremasteric muscle and fascia, this cremasteric muscle and fascia are important because these muscle are help elevation of the testis in cremasteric reflex, which is protective and supplied by genitofemoral nerve. The dartus muscle here and fascia is smooth muscle which is supplied by autonomic nerves joining the ilioinguinal nerve. Also, this dartus muscle is important for protection and also important to keep temperature around the testis. Here we study the testis, which is primary sex organ and important for production of sperm and testosterone. Here is the dimensions of the testis. Here is the length, width, and thickness. Here is the volume, and here is the weight. The testis has, as you see here, the testis has upper end. I cannot go back, so I will make a diagram. So the testis has upper end and lower end. It has lateral surface and the medial surface. It has anterior border and posterior border. And above the testis, you can find here the head of epididymis here. Blood supply of the testis include testicular artery from abdominal aorta. Also, there is additional arteries like artery of vas deferens and cremasteric artery. The venous drainage of the testis is different in right and left testes. The left testis drains to the left renal vein, but the right testicular vein drains into inferior vena cava. These veins arise from what's called bambiniform plexus within the or deep to the scrotum and inside the spermatic cord. This varicosity of bambiniform plexus is called varicocele. So that is also drains to lumbar lymph nodes and supplied by sympathetic fibers from T10 to T11. So here is the again here is the testis here, and here is the bambiniform plexus here, which forms the testicular veins, and you can see here the left renal vein draining to the left renal, left testicular vein draining to the left renal vein, and right testicular vein draining to the inferior vena cava. Varicocele or dilated enlarged testicular veins or bambiniform plexus are more common in left side. You have to know the answer by yourself. Also, here is the blood supply. Varicocele can be painful, especially during long standing, and usually primary varicocele affect young men. However, secondary varicocele due to testicular tumors compressing the gonadal testicular veins or compressing the left renal vein can also, or right renal vein can affect older age and has progressive course and rapid onset. Primary varicocele in young men can feel as bag of worms when you examine it by touch. This varicocele should be treated surgically or by embolization, and the failure of treatment or improper treatment of varicocele may result in male infertility. Another disease related to the testis is hydrocele, where there is accumulation of fluid between the two layers of tunica vaginalis. As I told you, tunica vaginalis is a layer which surrounds the testis here. So outer layer here is called visceral, and the inner layer is called parietal layer of tunica vaginalis. Between the two layers, you can find the cavity, which is filled with serous fluid. Excessive accumulation of serous fluid in this cavity leads to this disease, which is called hydrocele, and is felt as cystic swelling. It could be non-communicating, or it could be communicating. Cryptokidis is a disease resulting from failure of descendment of the testis, or failure of descending of the testis to scrotum. As you know that the scrotum is testis is abdominal organ, and then during embryonic development, it descends downward to the testis, to the scrotum. So failure of descent results in undescending or cryptokidis, which should be treated surgically by operation called orchidopexy or orchidopexy. And failure of treatment results in testicular apoptosis, infertility, and cancer. Here is just as you see when you cut the testis. When you cut the testis, you can find that the testis contain inside here seminiferous tubules. These seminiferous tubules, of course, contains the germ cells and sperm. When you make cross section in seminiferous tubules, you can find here one seminiferous tubule here, this one, another one here. Inside seminiferous tubule, you can find Sertoli cell here, where the nucleus here is triangular, and you can find various kinds of germ cells like spermatogonia, spermatocytes, spermatids, and sperm here at the lumen. Between seminiferous tubules, you can find here the interstitial cells or lining cells, which are acidophilic and produce testosterone. This is lining cells or interstitial cells. Also in the interstitial space, you can find here testicular blood vessels, like here, for example, here. And also in the, as you see here, Sertoli cell has two parts, basal side and the apical side. So basal side is close to the basement membrane of seminiferous tubule. Apical side here related to the lumen. Sertoli cell has several functions like protection and nutrition for sperm or germ cells, and also phagocytosis of dead sperm or germ cells, and also formation of blood testis barrier. Spermatic cord is just the structure like this one which convey the blood supply and carries the sperm from the testis. So the testis is suspended from the spermatic cord here, and you have to know about the contents of the spermatic cord, like for example, such as bambiniform plexus, for example, testicular artery, vas deferens here, for example, which can be felt when you touch the scrotum, and also additional structures like cremasteric nerve, genitofemoral nerve, for example, cremasteric artery, artery of vas deferens, some lymphatics. Here is the cross section which shows the contents of the spermatic cord. Some embryonic structure related to the spermatic cord, for example, processus vaginalis and gaberniculum testis. Sometimes the spermatic cord is can be twisted or rotated around its long axis, and this is called torsion. And this is torsion, like here, can obstruct the blood supply of the testes and results in testicular necrosis and gangrene. Here is the blood supply of male pelvic organs and the perineum, including bladder, prostate, seminal vesicle, vas deferens. As you see, the prostate here, for example, seminal vesicle, vas deferens supplied by pherophaseal artery. Superior artery here branch from umbilical, which is branch from internal iliac. As also you see here, the internal pudendal artery is branched from internal iliac, which give scrotal branches to the scrotum, and also give branches to the penis, as I will tell you later. Here is the structure of penis. It's formed from glands here, or glands here, body, and posterior part under the pubic bone. We call it root of the penis. The root of the penis is formed of two crura here, right and left, just under the pubic arch, and bulb here. The two crura will continue and form the two corpora cavernosa, which is dorsal, right and left corpora cavernosa. The bulb of the penis will form the corpus spongiosum, which contains the penile urethra. The penis is formed of or surrounded by skin and superficial fascia, and then deep fascia, as you see here. These deep fascia here are important for erection. Deep to the deep fascia, you can find the blood supply and the nerve supply of the penis, like arteries, for example, here, deep dorsal artery of the penis, deep dorsal vein of the penis, and dorsal nerve of the penis. Superficial to this deep fascia, you can find a vein called the superficial dorsal vein of the penis. The glans penis is surrounded by skin fold called foreskin or prepuce, which sometimes removed surgically in circumcision. So here is the cross section of the penis showing the blood supply. It's very important. And also you can see the two corpora cavernosa and the corpus spongiosum. Here is the circumcision and its importance. Here is the nerve supply of penis, including other structure like prostate, seminal vesicle vas, and bladder. As you see here, the nerve supply of the penis mainly come from pudendal nerve, which through its branch, which is dorsal nerve of the penis. Okay, the autonomic nerve supply of penis, prostate, seminal vesicle vas deferens, and bladder is either sympathetic or parasympathetic. The parasympathetic nerve supply arises from this sacral plexus through the pelvic splanchnic nerve, which joins here the inferior hypogastric plexus. The sympathetic nerve supply is rising from sympathetic trunk. Also, this sympathetic fibers join this plexus. Here is the mechanism of erection and ejaculation. So, erection is stimulated by or controlled by pelvic splanchnic nerve, which is parasympathetic. And this erection is maintained by blood supply, and also by innervation, controlled by blood supply and innervation. Both are important for erection. Failure of erection due to insufficient blood supply or damage of pelvic splanchnic nerve results in erectile dysfunction or impotence. If erection is continued for a couple of hours without Ejaculation, this condition is painful and is called priapism and should be treated surgically. Ejaculation is controlled by sympathetic nerve fibers, and also this mnemonic help you to understand the nerve supply of the nerves controlling ejaculation and erection. This is just by yourself. Try to do it by yourself. For example, here is the corpus spongiosum, which contains a vinyl urethra. Here is one of the corpora cavernosa. For example, here is the bulb of penis. Here question you should answer by yourself. Next is prostate. As you see, prostate is retropubic organ behind, or I mean it's behind the pubic bone. It is ventral to, you see here in this sagittal section here. Here is coronal section. So prostate is fibromuscular gland, retropubic in location and in front of the rectum, and the process surrounds the bladder neck. That's why sometimes you do PR examination. So in this case, the prostate will be anterior to your finger, and while the rectum will be posterior. Here is the loops, zones, and contents of prostate. The loops can be detected or seen in coronal section, in sagittal section, and so in sagittal section here is anterior side and here is posterior. So here is should be location here of the rectum here. So the prostate, and here is the bladder above here, for example. So prostate is conical in shape, has base above here surrounding the neck of bladder, and has apex down here closely related to the deep perineal pouch, or above the deep perineal pouch. And prostate here has anterior loop here and posterior loop, and also has median loop. On coronal section, you can find also there is additional loop like right and left lateral loops. As I mentioned, the base is above, surrounds the neck of bladder, and apex is down. Here is cross section of the prostate, where you can see here that the prostate is surrounded by capsule here, and then outside there is also another capsule or fourth capsule from fascia, and between the two capsules you can find the prostatic venous plexus, which drain to the internal iliac vein. Prostate also contain, as I mentioned, the contents. As you see contents here, for example, you can find here the prostatic urethra and also ejaculatory duct here, which open inside the prostatic urethra here. And also you can find also prostatic utricle and prostatic glands and sinuses. The new classification of prostate is divided into zones. So prostate has 3 zones. One surrounding the urethra, we call it transitional zone. I mean, surrounds the prostatic urethra. One surrounding the, or two, one part surrounds the 2 ejaculatory ducts, right and left. We call it central zone. And one peripheral, we call it peripheral zone. It is very important to know that the median loop or middle loop, or corresponding to the central zone here, is part usually commonly affected by senile hyperplasia, or the posterior peripheral zone here, or you can say the posterior lobe of the gland is the part which is more commonly changed to cancer, or cancer prostate is common in this part. So here is the cross section, histological section showing the contents here of the prostate, where you can find here prostatic urethra here. Also, you can find here the ejaculatory duct. You can find also the prostatic utricle, and also you can find here the glands of prostate here. Here just I don't want here is the dimensions and volume of the prostate and weight. I think I already mentioned these parts here. Okay, especially the contents are very important. As I mentioned, the prostatic urethra here within the prostate has dilated part called urethra crest, which is dilated which is found in the posterior of prostatic urethra, and there is enlarged part of this crest called seminal colliculus. This part, seminal colliculus, this part here, and it's called verumontanum. This seminal colliculus receives the opening of two ejaculatory ducts here and prostatic utricle. Prostatic utricle is embryonic remnants or remnant of Mullerian duct. Here another image which shows a seminal colliculus or verumontanum and structures which open in the seminal colliculus, as I mentioned before. Here is a slide showing blood supply of the prostate and also other structure like here the seminal vesicle lateral, and here also the vas deferens, or you can say dilated part of the vas deferens here, which this part here, which is called amble of vas deferens. So the main artery supplying vas, seminal vesicle, and the prostate is called inferior vesical artery, which branch from internal iliac. The prostate may receive additional branches from middle rectal artery, for example, and also may receive branches from superior vesicle if it's too long. Here is the clinical anatomy of the prostate. As I told you, the median lobe of the prostate is commonly enlarged in prostatic hyperplasia or senile hyperplasia. The posterior lobe is liable to be cancerous, or the prostate secrete many secretions like PSA, which help diagnosis of senile hyperplasia prostate and the cancer prostate. It also secretes prostaglandins, uric acid, and proteolytic enzymes and acid phosphatase. Very important to know that the prostate cancer spreads by prostatic venous plexus through the vertebral venous plexus, through or via the veins of Batson. And digital rectal examination can detect cancer prostate or senile hyperplasia. Okay. For cancer, we can do radical prostatectomy. In cancer, the prostate can drain also to the internal iliac lymph nodes. Here, just slide showing how this hyperplasia of prostate or benign or senile prostatic hyperplasia can induce can cause urinary symptoms like what? Such as nocturia, dysuria, urgency, and dribbling. It is, as you see here, his median loop, which is found between prostatic urethra here and ejaculatory duct here. Okay, as you see, ejaculatory duct penetrates the prostate from both lateral sides. So this median loop or middle loop can enlarge and even ascend inside the bladder here. and obstruct partially the internal urethral meatus, and this results in the creation of pouches which are filled with urine, and this urine is stagnant here. That's why there is urinary symptoms. So there is operation called TUR, where you can remove the prostate in this disease by cystoscope or endoscope. Seminal vesicle here is gland which also important for penetration of the sperm. It produces fructose and choline, and it has alkaline secretions. Seminal vesicle, as you see, it is lateral to the vas deferens, and it's located between the bladder base or bladder fundus and the rectum, and this seminal vesicle has duct. This duct unite with the duct of seminal with the duct of vas or ductus deferens to form the ejaculatory duct. Here is the histology of seminal vesicle, and this secretion of seminal vesicle can also be important for detection or diagnosis of rape. So that's why it has forensic importance. The vas deferens is the duct which carries the sperm from testis to the prostatic urethra, and it is about 45 centimeter. The vas deferens arise from the tail of the epididymis. Maybe I forgot to tell you about the epididymis. Again, here is the testis, and here is the head of epididymis, and here is the body, and here is the tail here. So head, body, tail. From the tail of epididymis, the spermatic cord arises upward. So the spermatic cord arises from the epididymis, ascending forward through the spermatic cord within the inguinal canal here, and then exits the inguinal canal through the deep inguinal ring to enter the pelvis, where it unites with the duct of seminal vesicle forming the ejaculatory duct, which opens into the prostatic urethra. You can see here the vas deferens is crossing here over the the pelvic part of the vas deferens here is crossing over the ureter. Vas deferens can be ligated or removed as a contraceptive procedure. Here is this very important sagittal section which shows the male reproductive system. It's very important. Try to answer by yourself. Here is some questions. Try to answer by yourself.